Hello listeners, welcome to Views on Health. On the program tonight is Dr. K.V.C. Janaka, consultant physician at the Sri Jayawardhanapura General Hospital in Kotte, Sri Lanka. Having said that, I should extend a very warm welcome to you, Doctor, back in our studios after quite a while. So it's a pleasure to have you with us on the program today, and for the information of our listeners, the topic under discussion is the importance of exercising, especially for patients. We all know that we need to exercise on a regular basis, and it keeps us fit, it keeps us healthy, and of course it varies the type of exercise that we do according to our age and whatever ailments we may have or may not have. But however, the focus on the program is how important it is for patients. Over to you, Doctor, to enlighten us on this important topic.
Yeah, good evening. We are now focusing mainly on exercise, like what are the exercise a patient, especially a patient with non-communicable disease should do. Now, this is a very common question that many patients have asked us. Now, say, I'll just give an example. Say, if you have high blood pressure, when you say that you have high blood pressure, when you just diagnose, the first question they'll say, can I do running? Can I go to the gym? Things like that. So, it is important to know about these things also. Yeah, the exercises are important for a healthy as well as a unhealthy person. Unhealthy in the sense, not somebody who's having an acute illness, like somebody who's having a viral fever or a bacterial infection, you should not do exercise. But this is for chronic diseases, it is important. So what the number one is, as you already mentioned, the exercise will improve the muscle power. It will improve the cardiac function. It will improve the heart. The exercise will improve the blood flow. Exercise will improve the metabolism, like it will reduce the glucose, it will reduce the bad cholesterol, and it will give some mental improvement, psychological improvement. It reduces dementia. So a lot of things. So those are common for anybody, for a person without any illness or a person with illness. But say we take somebody who is having chronic illness. Now I'm just trying to focus here on mainly 2 or 3 common illnesses like high blood pressure, diabetes, heart disease. Those are the 3 major issues that people come across. Or sometimes things like asthma and chronic lung diseases. Now, when should somebody not do exercise? This is also important, because especially if you are having a fever, that is a viral or bacterial infection causing fever, you should not engage in exercise, because we don't know the extent of the spread, and mainly even the simple viral fever, there can be some viruses get spread throughout the body, so there can be effect on the heart. So even if you have a simple viral fever, you may feel fit to go to gym, but don't go. So acute illnesses, you are not allowed to do exercise. If from when you take the chronic, like if you had a recent heart attack, then you should get your doctor to make you fit, say that you are fit, your weight, and get his approval when you should start doing exercise. If you have heart failure, again, if you are breathless, then you should not engage in exercise. But gradually, when you are improving, you can do exercise. Then if somebody has a recent we call embolism, like blood clot going into the heart, the lung, or the brain, or something like that, then you should not do exercise for a few weeks. But all the other patients, say if you have had a heart attack, then we'll start with the heart. If you have had a heart attack, it is recommended that you gradually improve your exercise, and after about 2-3 months, you go back to your normal exercise routine, depending on the the reserve that you have in the heart, but you should try to develop your exercise capacity gradually. So if you have had a heart attack in the past, it's not a contraindication to do exercise. You should gradually build up. After you were sent home, you gradually improve your activity. Initially you walk within the house, then just to the garden, maybe just to the nearby shop, and then gradually you go to the walking pathway and start doing over the few weeks, you start your workouts. So anybody who has had a heart attack, there's no contraindication to do exercise. Even if somebody is having heart failure, when the patient is stable, after the medication, it is important to go back to do exercise. If somebody has had a heart rhythm problem, and then you have had a insertion of a pacemaker or something like that, again after the initial assessment, you should go back to gradual exercise. So those things are not contraindication. Actually, they are indications to do exercise. Right? If you had, but not immediately. Always you should get your cardiologist to assess you and certify that you are fit to do exercise. Then gradually build up your exercise capacity and get involved with the exercise. Then high blood pressure. Again, the patient with high blood pressure, it is proven that when you exercise, the blood pressure drops. Not during exercise, after the exercise. So when you get involved with the regular exercise for a long period, the blood pressure will drop a little bit. It's not like giving drugs, but to some extent it will drop. So anybody who is diagnosed to have high blood pressure should do exercise. Only thing against that is if your blood pressure is not controlled. Now, when you are diagnosed to say you have high blood pressure, doctor might say, right, first, if the pressure is not very high, he might say, first few 3 months or 6 months, we will try lifestyle. That is healthy diet and exercise. So healthy diet and exercise can reduce the blood pressure. So mild high blood pressure, our prescription will be to do exercise and diet control to get the pressure under control. Moderate and if the pressure is more than that, or if you have any other risk factors and things like that, then we might start the patient on the treatment. After the treatment, when the blood pressure is controlled, then you should do exercise. If the pressure is very high, we know that there's two things, systolic and diastolic. So if the systolic blood pressure is more than 180 at rest, then you should not do exercise, because during the exercise also pressure goes up. So then you should not do exercise. But any other person who is having, say, a blood pressure of 140/90 or 150/90, 160/90, they can do exercise. They should do exercise with the treatment. So they should continue the blood pressure tablets and do regular exercise, and they can do it in their full capacity. So it is important also, because the exercise will reduce the pressure, and it will prevent further, like as I already told, reduce the cholesterol, improve heart, so prevent heart attacks and things like that. So anybody who is having high blood pressure should do exercise. Few things important now. Sometimes with some blood pressure tablets, after exercise, the pressure drops, and with the tablets also the pressure might drop little bit lower than we want. So sometimes you may feel faintish. Then you have to discuss with your doctor and adjust the dosage. Now, because you might be having like what we call orthostatic hypotension, or the blood pressure dropping when you are up. So it can happen after exercise, especially if you are on some of the medications. And other thing is, people on some blood pressure tablets like diuretics, tablets which causes to pass some urine. So during exercise also you sweat a lot. So they might get dehydrated. So we have to be careful. In that case, you might have to drink a little bit more water to prevent dehydration. So that is important. But otherwise, high blood pressure is not a contraindication to do exercise. Actually, it is an indication to do exercise.
Thank you so much, Doctor, for starting off with various ailments, specifically the heart and high blood pressure, and the importance of exercise. So what we gather from this is that essentially the patient has to follow medical advice.
Yes.
In terms of taking the medication or without. Sometimes, as you said, if it's mild high blood pressure, you just have lifestyle and exercise to, you'll use those methods to bring the pressure down. Otherwise, you will go in for medication, of course, and you'll prescribe it for the patient. But the patient has to follow medical advice, is what we gather from this. Is that correct, doctor? Not just to exercise the way we want to, but when we have this problem, this health condition, the NCD, and we follow, we have to take this medication if we are on medication, lifestyle, of course, proper diet and all of that, and then exercise according to what the doctor says do, not to overdo. Am I right there? Because one can get carried away sometimes. Think the more I exercise, the more my heart condition will improve, the more my blood pressure will come down.
Yeah, definitely more you exercise, things will improve, but the intensity is the issue. So the intensity and the duration, like how hard you are going to do the exercise. That part, and when to stop and when to restart. That part you have to get the advice from the doctor. Right. So usually what we say is it's better to do mild to moderate intensity exercise. The moderate intensity mean, now if you say, when you do the exercise, if you can talk, right?
While exercising?
While exercising. If you can talk, but you can't sing, that is moderate. If you can't talk, it is high intensity exercise. So you should not go to high intensity. You should do mild intensity, that you can talk and sing and do anything while exercise. That is mild. So you can start with mild intensity. And for the cardiac health, you can go up to moderate intensity gradually. So moderate intensity varies from person to person. So the rough thing is that when you are doing the exercise, if you can talk well, or communicate few sentences with other people while they doing the exercise, that is moderate intensity, that is good. You can do it. But if you are breathless and you can't even talk during the exercise, then you have to be very cautious, because that is not recommended for patients with heart problems or very other high blood pressure and things like that.
So doctor, now something like high blood pressure, diabetes, heart disease are rampant today in the younger population, young as in from 20s to 30s you get patients. They may not be the majority, but they are there. And of course goes on to, as progressively as they grow older, and even old people get it. Now, obviously the exercise, like I said a while ago, is based on medical advice. Now, a younger person, by exercising or following medical advice, if he or she is affected with one of these problems, do you think it will, in the long run, definitely augur well to contain the problem from becoming out of hand?
Yeah, definitely. That is why the exercise will reduce the blood pressure, it reduces the heart disease, it reduces the heart attack, it reduces stroke, it reduces depression. So it helps in every way. But as I was telling, that the intensity of the exercise and the duration will vary from the age. According to the age, not only age, there are a few other things. Age, then your disease condition itself, because there is a limit you can do with the, say, mild blood pressure, high blood pressure, or somebody having high blood pressure and heart disease and diabetes and all the things. So the disease condition, the stage of the disease, and the nutritional status. So if somebody who is not very fit to like eat, who can't eat properly, then he can't go and do a lot of exercise. So there are situations like that. So all this nutrition status, the stage of the disease, the age of the patient, and sometimes some problems like if you have a stroke or something, the mobility matters. So the type of exercise, the intensity and the duration may vary. That is something that it's individualized. So you have to go to your doctor, get his advice. What are the best exercise you should do? Or you can ask your physiotherapist. What are the best exercise that we can do? But you should engage in exercise definitely, any person. So then those are the main things. And diabetes is a special situation. Diabetes, there are few specific things related to diabetes. Definitely exercise will improve your blood sugar, because you will burn more glucose. So definitely blood sugar will be better control when you do exercise. But if you do excess exercise, sometimes there's a risk that blood sugar can drop too low. So you have to, when you are taking insulin or drugs like glycoside, glibenclamide, tolbutamide and things like that, where the blood sugar can drop, you should have something to eat with you always, especially when you're on the ground. Because if you when you are exercising, if the blood sugar drops, you should have some banana or biscuits or something in case you need it. So that is important. And ideally, so you should gradually decide sometimes when you initially start, when you gradually improve your exercise capacity, the blood sugar is also dropping. So you might have to reduce your medication or the insulin dose with your doctor's advice when you are gradually improving your exercise duration and the intensity. So, but it is important. Definitely it is important. Because other than most important thing is not only blood sugar control, diabetes is a very high risk for heart disease and all other vascular diseases. So exercise will prevent that more than the diabetes control. Other thing is diabetes, the foot, because you know that we get a lot of diabetic neuropathy. You have to protect your foot during the feet mainly, because you have to have a good pair of shoes, protective shoes, not too tight. If you get a shoe cut, then your exercise will end up in having a problem. So a lot of foot care, and where you walk, the surface that you walk, a lot of things has to be there. But it is important to do exercise.
So exercise is a must, throughout.
Yes.
Irrespective of your ailment, because see, doctor, even a healthy person, a normal, I would say a person without any of these NCDs, still needs to exercise.
Healthy people definitely has to do exercise. That is no issue about that. The people with illnesses also, like chronic non-communicable diseases, also should do exercise depending on their capacity.
Doctor, if you take the genders, obviously we come back to the fact that it is based on medical advice, the type of exercise you have to do. So what a male patient might do, would it be similar to what a female patient would be asked to do? And if you take, you speak of exercise, basically it is accepted or it is said that walking is the best exercise. Would you please comment on that?
Male and female, there is no difference in what you should do. Both, if you can do, running is anybody can do. Weightlifting anybody can do. So male and female, there is no difference. The only difference is that the strength. The males have more muscle power, Females have less muscle power naturally, but there's no differentiation in the type of the exercise or the amount of the exercise or even weightlifting. There can be females who can lift more weights than some males. So there's no differentiation on that. And just you have to think of the figure, the muscle build, how much muscle you want to build and things like that. But otherwise there's no difference. In patients' illness also, there's no difference to say in a male patient or a female patient, there's a big difference in doing exercise. No. Walking is the best in the sense it is a good aerobic exercise. It improves the muscle power in the legs. It improves the blood flow. We know there's a thing called intermittent claudication, where the people with diabetes or heart disease, where high cholesterol get deposited in the legs, and then you get pain when you walk. So those things get improved, and because it is an aerobic exercise, it improves the blood, reduces the blood pressure, and there's a cardiac protection.
A question there, doctor. Now, it's interesting that you said that with these deposits, or whatever that settles in the legs, will improve with exercise. And you spoke of people saying they have pain. Now, this is something we hear regularly. I'm asked to exercise, but when I start walking, my legs hurt or my feet ache. How can I do it? So your answer there is that it is important, it can reduce, it can recede.
Yeah, now in any exercise, when you do for the first day, you will have some muscle pain. So that tolerance you will develop, the muscles, the joints and things. Initially there will be some muscle pain and joint pain, which is not a major issue, which will improve gradually. Now when you walk, now if you have a joint disease like arthritis or something, then you might have to wear a proper shoe or get some advice or put some say brace or a knee guard or something like that. That advice you should get from your doctor. But otherwise, having some pain initially is a common thing, but it goes off. Definitely it will go off.
What's the frequency of exercising? Daily or X number of days a week?
For a healthy person, what we say is at least 150 minutes per week. That is 30 minutes per day for 5 days. It is similarly applicable to a patient with high blood pressure or heart disease or diabetes or anything. They also can do the same amount, but not them. They have to start slowly. Initially they might do 10 minutes a day, will gradually go up to the 30 minutes level. So you can do at least 150 minutes per week of moderate exercise. If you're a healthy person who doesn't have enough time, then you can do high intensity 45 minutes per week. But it's better to divide it, because you can't just do 150 minutes once a week and say that I have done my quota. No, you have to divide it over the week, but you can break it down. If you don't have 30 minutes per day, you can do 3 times 10 minutes per day and divide it in, while incorporate it into your routine daily activities. Like you can climb some stairs, you can walk fast from the bus to the home, things like that. So you don't have to be 30 minutes in the gym or the ground. You have to be active, doing moderate intensity work, at least 30 minutes a day.
So it's flexible.
It's flexible.
That's very encouraging, because not everybody would think like that. And thank you so much for sharing that valuable bit of advice with our listeners, that their exercise can be, for the day, can be broken into X number, maybe twice or thrice for the day to cover the 30 minutes. And the 150 minutes can be spread over the week.
It should be spread.
It has to be spread, of course. And would it be like, for example, I'm not trying to be, but I say very difficult here, but to say 20 minutes today and then make up the other 10 minutes extra another day, or you wouldn't advise that?
No.
Thank you, doctor. So time has caught up with us. What's your take-home message?
Exercise is a must for everybody, unless your doctor say that It's contraindicated for some period due to the few things that I mentioned earlier. If you should get your doctor's advice and get involved in an exercise program.
Thank you, Doctor. We end this interesting discussion on the importance of exercising for patients. And we're grateful to Dr. K.V.C. Janaka, consultant physician, Sri Jayavardhanapura General Hospital in Kotte, for being with us on the program and sharing a valuable insight on this very important topic for patients. Thank you, Doctor. My thanks also go to Sandaruwan Lienage for technical assistance. I'm Fatima Razi Kader, bidding you good night and looking forward to your company next Monday, same time on Views on Health.